गाइस, वेलकम टू द डॉक्टर्स इन डार्क। और आज हम बात करने वाले हैं फॉरेंसिक मेडिसिन टॉक्सिकोलॉजी एमसीक्यूज 5 फास्ट एमसीक्यू सीरीज एपिसोड 2। और आज हम पढ़ने वाले हैं फॉरेंसिक मेडिसिन टॉक्सिकोलॉजी फॉर द नीट पीजी। तो चलिए शुरू करते हैं। इससे पहले अगर आपको हमारा चैनल अच्छा लगता है तो प्लीज़ लाइक एंड सब्सक्राइब द चैनल। तो चलिए शुरू करते हैं हम। एमसीक्यू 1, फार्मर प्रेजेंट्स विद अ स्नेक बाइट वुंड ऑन हीज राइट फुट. There are two fang marks, bleeding and swelling at the bite site. Next step for management is the farmer is present with a snake bite wound on his right foot, so it's called a case of the snake bite. There are two fang marks, means there is a poisonous snakes bleeding and swelling at the bite site. The next step for management is, तो इसका आंसर है स्प्लिंट लीडिंग टू द इमोबिलाइजेशन। इसका एक्सप्लेनेशन हम बाद में पढ़ेंगे। इससे पहले जान लेते हैं कि स्टेप ऑफ मैनेजमेंट ऑफ स्नेक बाइट इज अ राइट आर फॉर is a right and this suggest that splint and immobilization of the patient, then go to the hospital and then treat the patient with anti snake venom. तो ये था हमारा पहला क्वेश्चन। अभी जानते हैं क्वेश्चन 2। अननोन सब्सटेंस कंजप्शन लीडिंग टू टेकिकार्डिया एंड रेड कलर्ड हेलोस इज सीन विथ। तो इसका आंसर है LSD। और इसका भी हम एक्सप्लेनेशन बाद में देखेंगे। पहले देख लेते हैं क्वेश्चन 3। चाइल्ड बिफोर प्लेइंग कंज्यूम्ड फ्रूट फ्रॉम गार्डन, ही डेवलप हाई फीवर, कन्फ्यूजन, फोटोफोबिया, अनेबल टू यूरिनेट. व्हाट आर लाइकली causative एजेंट एंड appropriate antidote? तो this suggestive of the fruit from the garden is suggestive of the datura poisoning, and symptoms like fever, confusion, photophobia, unable to urinate are the anticholinergic symptoms, and this can lead to by datura poisoning, and the antidote for the datura poisoning is the physostigmine. Question 4. Patient brought to the casualty with seizures. He had multiple episodes and on herbal medication for the same. He was conscious in between episode. He had arching of his back during episode. What is the cause? तो इसका आंसर है स्ट्रिक्निन। इसका एक्सप्लेनेशन भी हम देखते हैं बाद में। क्वेश्चन 5. अ पेशेंट कम विद कंप्लेंट्स ऑफ हेयर लॉस. हिज वाइफ नोटिस सम बिहेवियरल प्रॉब्लम, loss of eyebrows on lateral side. He then concludes by examining nails. What is the type of the poisoning? The answer of this is थेलियम। तो थेलियम इज़ द आंसर ऑफ दिस क्वेश्चन। तो ये है हमारे आज के 5 क्वेश्चंस। अभी हम जानते हैं इसके डिटेल्ड टॉपिक के बारे में। और आज हमारे 5 MCQ रिलेटेड टू फॉरेंसिक मेडिसिन टॉक्सिकोलॉजी PYQs कंप्लीट हो जाएंगे। तो चलिए शुरू करते हैं। स्नेक बाइट. Ophiotoxemia is the study of the snake poisoning. All poisonous snakes has a small head scales except cobra and common crate. They are poisonous but have a neostigmine is also used in the neurotoxic snake poisoning management. Now we can see the difference between poisonous snakes and non-poisonous snake. हेयर स्केल देखेंगे तो poisonous snake में small होगा except cobra and crate, and head scale is large in the non-poisonous snakes. Belly scale is large in the poisonous snakes, but belly scale is small in the non-poisonous snakes. They are nocturnal, but they are nocturnal poisonous snakes, but non-poisonous snakes can be seen 24 hours. And fang mark of 2 on poisonous snakes. Fang mark is semicircular in non-poisonous snakes, and tail is compressed in poisonous snakes, and non-poisonous snakes tail has a broad end. तो इस टॉपिक पे भी क्वेश्चन आए हुए हैं। आज हमने ऑफ कोर्स 5 टॉपिक्स में नहीं लिए, बट इस टॉपिक पे भी क्वेश्चन आए हुए हैं। तो ये इंपॉर्टेंट टॉपिक है फॉर द नीट पीजी, फॉर द पॉइजनस स्नेक एंड नॉन पॉइजनस स्नेक। नाउ हम आइडेंटिफिकेशन करेंगे फोटो। तो रसेल वाइपर लुक लाइक दैट. इट हैज़ a triangular head, so it's called viper. And cobra is the another image of the snakes. अभी हम देखते हैं मैनेजमेंट ऑफ द स्नेक बाइट. तो राइट इज द न्यूमोनिक्स. R for reassure the patient, I for immobilize the patient using slings, GH is go to hospital, and T is treat the patient with anti-snake venom 20 ml IV bolus. तो एंटी स्नेक वेनम इज द polyvalent prepare in Mumbai at Hopkins Institutes and useful against bites of cobra, common crate, Russell viper, Soscale viper, administered within 4 hours. Anti snake venom administered within 4 hours. So it is useful. तो ये था हमारा मैनेजमेंट ऑफ द स्नेक बाइट, और इसी के ऊपर से हमारे पहले क्वेश्चन का आंसर था इमोबिलाइज द पेशेंट यूजिंग स्लिंग। और अभी हम देखते हैं सेकंड क्वेश्चन का आंसर था एलएसडी, लाइसर्जिक एसिड डाई इथाइल एमाइड के बारे में पढ़ते हैं। तो इट इज कॉजेज टेकिकार्डिया एंड विजुअल हेल्यूसिनेशन ऑफ द रेड कलर्ड हेलो, विजुअल हेल्यूसिनेशंस ऑफ द रेड कलर्ड हेलो। Acid blotter or paper stamp or taken as a fumes obtained from rye fungus or ergot. Good trip symptoms are visual hallucination and illusions, and bad trip symptoms are anxiety and panic attack. Flashback phenomena. Re-experiencing the past experience is seen with lysergic acid diethyl amide. तो ये था हमारा सेकंड क्वेश्चन का आंसर, टेकिकार्डिया प्लस विजुअल हेल्यूसिनेशंस ऑफ रेड कलर्ड हेलो इज सीन विथ एलएसडी। अभी जानते हैं धतूरा पॉइजनिंग के बारे में, ऑल्सो कॉल्ड एज ए 9D पॉइजनिंग। एंटीकोलिनर्जिक पेशेंट यानी एंटीकोलिनर्जिक प्लांट यानी कि एट्रोपिन, हायोसिन एंड स्कोपोलिमाइन ट्रूथ सीरम इज द प्रिंसिपल्स ऑफ द धतूरा poisoning, and fatal dose is 0.6 gram to 1 gram, almost 100 to 125 seeds. Datura alba is white datura, Datura niger is purple datura, and Datura strontium is thorn apple. Carphologia is a picking of imaginary threads. Pupil, cone picker pupil with unilateral mydriasis, cone picker pupil with unilateral mydriasis, and mydriatic test positive, mydriatic test positive. This is a purple color, so it is called as a Datura niger, and this is white color, it is called as a Datura alba. अभी हम जानते हैं 9D धतूरा पॉइजनिंग। 9D कौन कौन से हैं? ड्राई स्किन, ड्राई माउथ, डिसआर्थरिया, डिस्फेजिया, ड्रंकन गेट, डायलेटेड प्यूपिल, डिस्यूरिया, डिलीरियम एंड डेथ। तो ये था हमारा धतूरा पॉइजनिंग के बारे में। अभी जानते हैं मोस्ट कॉमन रोड साइड और रेलवे पॉइजन, ऑल्सो नोन एज धतूरा पॉइजन, एंड एंटीडोट इज फाइजोस्टिग्माइन मोर देन पाइलोकार्पिन. Neostigmine is not used, but it is because it is not cross the blood-brain barrier. But physostigmine crosses blood-brain barrier and also helpful with the central side effect. But neostigmine is not used because it has no central effect of the antidote, because no central effect of the antidote leads to the datura poisoning ineffective. So central side effect is cured by the physostigmine but not by the neostigmine. अभी जानते हैं स्ट्रिक्निन के बारे में. स्ट्रिक्निन इज ऑल्सो कॉल्ड एज ए नक्स वॉमिका और कुचिला. Fatal dose is 1 crushed seeds or bitter taste. Active principles is brucine, strychnine and liganin. Uses are aeropoison, aphrodisiac, rodenticide, killing street dogs, and a respiratory stimulator. Mechanism of action is strychnine is act on the anterior horn cell or Rancho cells and inhibit glycine. So glycine is a inhibitory enzyme, and that can lead to the excitation, and overall effect is excitatory and mimics tetanus. Conversion in all muscles. Increase effect after electric stimuli. Convulsion in all muscles increase effect after electric stimuli. Most common position is opisthotonus, and that can lead to the hyperextension of the back. Pleurostotonus is lateral bending, and emprosthotonus is forward bending. And trismus and rhesus sardonicus also can seen in strychnine poisoning. Strychnine cause of death is respiratory muscle failure. Tests are Wenzel test and Sonnenschein test. Antidote is diazepam. Diazepam is the antidote of strychnine. Acidification of the urine can be done. Post-mortem caloricity is seen. Important topic about strychnine is gastric lavage is not done in the strychnine in initial stage. First treat the seizure with the antidote diazepam, and then gastric lavage can be done, but not with the seizure, because nasogastric tube intubation can lead to aggregated seizures, and that can lead to the worsen the side effect of the strychnine poisoning. This is the nux vomica seeds, or look like RBCs, or dog collar, or also called as a cuchilla. Thallium is ideal homicidal poison. Triad is alopecia, painful neuropathy, and skin rashes is as a triad seen mimics with arsenic poison. Differentiate by the lateral eyebrow hair loss. All other symptoms mimics arsenic poisoning, and arsenic poisoning symptoms are raindrop pigmentation can be seen. Then subepithelial cell damage can be seen. And also the gastric nausea, vomiting also can be seen. Gastric side effects can be seen. Loss of hair cell and loss of hair and misline can be seen also with thallium, but only differentiated is lateral eyebrow hair loss. So lateral eyebrow hair loss is seen with thallium poisoning and very specific for the thallium poisoning. Thallium also causes Guillain-Barré polyneuropathy. Treatment is Prussian blue. Treatment is Prussian blue dye. So this is about thallium ideal homicidal poisoning. थैंक यू फॉर द लिसनिंग. अभी हम एक बार फिर से सारे क्वेश्चंस देख लेते हैं क्योंकि हमने स्टडी कर लिए 5 टॉपिक्स. तो चलिए देखते हैं. पहला क्वेश्चन था फार्मर प्रेजेंट्स विद अ स्नेक बाइट वाउंड ऑन हिज राइट फुट. There are 2 fang marks, bleeding and swelling at the bite site. Next step for the management is the splint leading to immobilization, because the management of the snake bite is right. R for reassurance the patient, I for immobilization with the splint or GH go to hospital, and T for treatment with ASV anti snake venom. तो ये था हमारा क्वेश्चन 1 जिसका आंसर है स्प्लिंट लीडिंग टू इमोबिलाइजेशन इज द इनिशियल स्टेप्स. क्वेश्चन 2 इज अननोन सब्सटेंस कंजप्शन लीडिंग टू टेकिकार्डिया एंड रेड कलर्ड हेलो इज सीन विथ. It is seen with LSD because tachycardia and red colored halo is seen with LSD. So ये था हमारा सेकंड क्वेश्चन. क्वेश्चन नंबर 3, चाइल्ड बिफोर प्लेइंग कंज्यूम्ड फ्रूट फ्रॉम गार्डन. ही डेवलप्ड हाई फीवर, कंफ्यूजन, फोटोफोबिया, अनेबल टू यूरिनेट. दिस आर एंटीकोलिनर्जिक सिम्टम्स एंड एंटीकोलिनर्जिक poison is the datura poison. What are likely causative agent and appropriate antidote? तो causative agent is datura and appropriate antidote is physostigmine as we read. And datura is also called as a 9D disease, dry mouth, dry skin and delirium and death and dysarthria and all other D's. So this is 90 disease, and answer of this question is datura and physostigmine. Patients brought to the casualty with the seizure. He had a multiple episodes and on herbal medication for same. He was conscious in between episode. He had arching of his back during episode. What is the cause? So arching of the back during episode is and seizure is most commonly seen with the strychnine, and because it inhibits the glycine, this can lead to the excitation of the body, and this can lead to the excitatory symptoms, and this can lead to seizures. So answer of this question is strychnine. Question 5, a patient come with complaints of the hair loss. His wife noticed some behavioral problem, loss of eyebrows on the lateral side. He then concludes by examining nails. What is the type of the poisoning? The answer is the thallium, because in this there is a loss of eyebrows on the lateral side, and this is very common for the thallium poisoning than the arsenic poisoning. Otherwise the answer is confusing between the thallium and arsenic poisoning, but because of the lateral side eyebrows loss, the answer is the thallium. So this is all about the lectures on the forensic medicine toxicology 5 and fast MCQ with me. And if you like, then please like and subscribe the channel Doctors in Dark. And if you are a medical student, then suggest the topics on which you want MCQ to solve with us. Please like and subscribe the channel. We are come with the episode 3 next time, and this is our episode 2, forensic medicine toxicology for the NEET PG. And like and subscribe the channel, and thank you. Have a good day.